California. When we talk about scoliosis, we're talking about curves through the spine and twists that make concavities and convexities. Up till this point, the treatment for scoliosis was either just watch the patient and watch and see how it progressed, or bracing or surgery.
Scoliosis is a three-dimensional abnormality that occurs when the spine becomes rotated and curved. Most often the condition has no known cause. However, it can be seen through prominent shoulder blades and uneven hips and shoulders. Scoliosis affects about 2 to 3% of the population. In addition, about 10% of adolescents have some degree of scoliosis. Also, among persons with relatives who have had scoliosis, about 20% develop the condition.
I was diagnosed with scoliosis when I was 10 in the 5th grade, and I had to wear a back brace for 16 hours a day for 4 years until I was in the 8th grade when they finally decided that I had quit growing. And so after I quit wearing the brace, I still had to go to physical therapy for quite a while and do all different types of exercises to strengthen my back and my core and to hopefully not prevent the curve from progressing any farther, just in case that I shouldn't have quit wearing the brace yet. And so physical therapy really helped, but they also suggested that I should take up yoga or Pilates and exercises like that, so that I could just continue helping my back the best I can. And so I can really tell the difference in when I've done those things and when I haven't. I kind of get through like kicks and go through spurts of doing those types of exercises, and I definitely feel better when I do. One, just my overall posture is better, but two, my back feels stronger. Sometimes I can feel my curve a little bit more when I'm not doing it, when I get really tired and things like that. So I think it definitely has helped overall.
Pilates is a form of exercise that works to strengthen your core. All Pilates exercises come from 5 essential things. These are breathing, cervical alignment, rib and scapular stabilization, pelvic mobility, and the utilization of the transverse abdominis. My mother, Mary Watson, has taught exercise for 31 years. She received her first Pilates certification in 2001, and since then she has done extensive training in many different facets of Pilates, the most recent being focused on scoliosis.
I just finished a year-long mentorship with Karina Tech, the founder of Scolio Pilates in Oxnard, California.
Scolio Pilates is a 3-dimensional exercise program that utilizes elongation to lengthen the spine towards neutral, breathing techniques to open up areas of the ribcage and lungs that are locked from the shape of the scoliosis, strengthening to maintain the alignment once a more neutral position is achieved, and corrections using wedges where appropriate to assist the spine towards neutral. As a part of her year-long Scolio Pilates training, my mother had to do a case study on one of her clients. Karen is a 63-year-old woman who was diagnosed with scoliosis at the age of 16. The following clips are from said case study.
I had read in a magazine about Pilates and what it was doing for ballerinas because they had to have equal strength on both sides of their body. So I thought that might be a really good thing to search out to see if I could find a Pilates teacher.
Karen was correct in her connection between the training of the ballerinas and her own scoliosis diagnosis. As you can see in this picture, the muscles that are highlighted green are weak and inhibited, while the red muscles are tight and facilitated. Pilates is beneficial towards scoliosis patients because it is able to strengthen the entire back and help both sides of the spine.
It has made a tremendous difference in my activity level and how I do everything. I'm very much conscious of my alignment at all times, and it has strengthened me beyond belief. And now that we're doing the Scolio Pilates, we are seeing big changes. In fact, I go to a chiropractor once a month just for maintenance, and he has noticed for the last couple of months, every month, that there is a difference in my back.
Research has shown that Pilates exercises do have significant beneficial effects on the Cobb angle and weight distribution of patients with scoliosis.
I recommend Pilates to everybody I meet. It's the best thing that ever happened to me. I've been doing it for 15 years, and my life revolves around that appointment and my hair appointment.
In this before and after picture of Karen, you can see the significant difference in the muscle distribution and level of her hips after having training with Pilates. Something important to note about Karen is that she was already in the preparation stage of the trans-theoretical model. She sought out the Pilates herself. However, most people don't even know that this is an option for scoliosis treatment, so we have to make sure that proper education is out there for people that are in the pre-contemplation or contemplation stage. One of the most beneficial things about Scolio Pilates is that the instructors are trained individually to fit exercises to each client so that it is beneficial to all.
So what makes it so exciting is that each client's workout is different because each client's curves are different. We've had great success with this. If you know anyone that has scoliosis, or if you have scoliosis, please look into Scolio Pilates. Thank you.